I've got a question here from Pam asking for a friend, thoughts on cholesterol injections. And I assume she's talking about Repatha and Praluent here to reverse plaque and calcium in the face of extremely high cholesterol. What are your thoughts on Repatha and Praluent?
Yeah, so clearly we don't have any data that PCSK9 inhibitors reverse plaque. The data that we have around this PCSK9 inhibitors, these very powerful cholesterol lowering medications that are delivered by injection, is that they do severely lower cholesterol levels. And in people with a history of heart disease, that has shown some benefit in lowering certain recurrent events, namely non-fatal myocardial infarctions. But there is a lot of controversy around the data. And again, we were talking a little bit earlier how the influence of the companies might come into play when looking at data. And the large study that was done to get the original approval for the FDA and in Europe for PCSK9 inhibitors, there was a group that recently went back and reanalyzed that data. Very difficult for them to do. The companies certainly weren't open with sharing this data. They had to do Freedom of Information Act requests in Canada and in Europe to get the data. But when they reanalyzed the data, they found that there were a lot of deaths that were attributed incorrectly to being non-cardiovascular deaths. And when you properly attribute those deaths, it turns out that there was no benefit to these medications. And in fact, there was a suggestion of harm, that overall cardiovascular mortality was actually slightly higher in the group that got the medications versus the placebo group. So
absolutely. And so first of all, let's make everybody aware that that study you're talking about and all subsequent studies that got Repatha and Praluent through FDA approval and that they now show to doctors, all of those studies were designed by, funded by the actual company that sells the drug. And then the majority of the researchers either were employees of the drug company, or they own stock in the drug company, or they received a research grant from the drug company. And many people don't know that, but if you're in the research field, you're always looking for money to do studies because studies are expensive. And so if you can make a good partnership with a huge billion-dollar pharmaceutical company and maybe tweak the data just gently, just slightly, not doing anything that's just overtly immoral or unethical, but maybe leave this out, maybe misclassify this, maybe call this death some other reason than, they were on the drug and they died, then that's going to establish a better relationship between you and that billion-dollar corporation with deep pockets and big checkbooks. Isn't it true that every single study that's been done about Repatha and Praluent was designed and funded by the drug company that stands to profit from the results of that study?
Yeah, as far as I know, there haven't been any independently funded studies that show benefit of these medications. And really, also understand that the measure of success of these medications has become, do they lower LDL cholesterol? The outcomes really aren't even looked at anymore. It's just, does it effectively lower LDL cholesterol? And it's just accepted as truth, as gospel, that if they're lowering LDL cholesterol, then they must be benefiting cardiovascular outcomes. And of course, we know, we've had the discussion many times that those two things don't necessarily correlate. So those are some of the many reasons to question the science that's out there. The other thing to understand about some of these studies is if the results aren't in favor of the pharmaceutical company, they're simply not going to get published. There is not a requirement to publish studies. We do have more stringent requirement these days about registering studies, and you have to declare that you're doing the study. But if you do a study, and the study is supposed to last 2, 3, 5 years, as these studies often do, and at the end the results, aren't what you want them to be, and you just don't publish them, the reality is most people are going to forget about that. They're not going to remember that you even started the study in the first place. So oftentimes that's another way that the published scientific literature gets influenced, because negative studies just won't get published, or if they do get published, they'll be published in some journal that no one ever reads. And they're not the studies that you're going to see hitting the headlines of CNN and the New York Times.
So then the question could pop up, well, how many studies were done about Repatha or Praluent that didn't show a benefit, or that showed a negative outcome? How many of those studies were actually done? And the answer would be, we have no idea, because that is considered by the U.S. government anyway as proprietary information owned by the corporation. Even if they received federal funding to perform the study, and so maybe they got $200,000 or $300,000 from the NIH, that is proprietary information owned by the corporation. If one of the researchers were to release that study, they would immediately be sued for millions, if not more, dollars. And so everybody knows to keep your trap shut if there's a negative result. And you're exactly right. They now have to register a new study that they're planning on doing. But if that study results, it doesn't turn out like they wanted to, that study can disappear forever. And that's in my opinion, highly unethical, highly immoral, but it's not illegal. That's their intellectual property. That's how it's looked at. Now let's talk about Repatha and Praluent, because I predict that within 5 to 10 years, this is going to end badly. Okay, because these things, they lower LDL. There's no question about that. And they lower LDL much more precipitously than do the statins like Zocor, Lipitor, Crestor. And in my opinion, that is inherently inherently dangerous, because we know that at least one thing that LDL cholesterol does is it's very intimately related to the proper function of our immune systems. Right? That's very, very important. And so when you start lowering people's LDL cholesterol down to 30 or down to 40 with Repatha or Praluent, that's not going to end well. And so people don't realize that they're like, well, they surely done research on that. No, my friend, they're doing the research right now. When you go to your doctor and you pay your copay and you wait for an hour and you get your Repatha prescription, you go home, you inject it once a week. They're following you. They're tracking you. You are the experiment right now. There is no long-term data right now. Everybody out there, if you're taking Repatha or Praluent, there is no long-term data showing long-term safety of either one of these drugs. That experiment is going on as we speak, and you are the lab rats. And so when something does come out of this that's terrible, like happened recently with Vioxx, that wasn't just an accident. That's the way it's set up to function. If something bad happens, we'll know about it in 2 or 3 years when you are having the problem. And so if any of you guys are out there taking Repatha or Praluent, you are the research, you're the lab rat. And that's on the back of your life and your health. That's how we're going to find out that these things are ultimately very, very bad for you. Have you seen any research on lowering people's LDL cholesterol down to 20 to 30 to 40? Because I've seen many cardiologists on Twitter saying, I'd love to lower your LDL to 0.
Yeah.
What have you seen?
Yeah, it's interesting. There certainly isn't studies looking at that, as you said, with these new medications. If we go back through the historical literature around cholesterol, we see that low cholesterol was a significant concern. It was a marker of death, essentially, or risk for death. If you look at older people, not on medications, those that have a lower cholesterol level are at an increased risk of mortality. And, that's because of things like cancer. That's because of infection. As you said, cholesterol plays many essential roles in our bodies. It is the precursor for many of our hormones, and it is involved in our immune system. And to think that we should just be eliminating this from our bodies is a very concerning concept to me. And then now we are putting that into action. And again, you don't have to look hard to find other examples of medications that were thought to be very safe and they went bad. You mentioned Vioxx, thalidomide is obviously a very prominent example. There were a number of medications related to the cholesterol issue that were developed to raise HDL cholesterol level, and they were demonstrated to raise HDL cholesterol, but they had many side effects and were ineffective in preventing heart disease. So it is not the same. You can't just make the assumptions that moving these markers in the direction you want them to move is going to have the effects that you intend them to. And you also can't ignore the other effects that occur from that. And we refer to them, it's funny, we refer to them as side effects. But the reality is we're not talking about side effects. We're talking about effects of the medication. The effect of these medications is to lower LDL cholesterol dramatically. And to just say that that's not going to have any other, ill toward effects in the body is crazy. And, I see it now in my patients. I see many men who are coming to me and they're on these medications and they have extremely low LDL cholesterol levels, and their testosterone is in the tank, and they are suffering all sorts of effects from low testosterone. So that's one obvious, short-term effect that I'm seeing. And then, of course, the long-term concerns around brain health and then around susceptibility to cancer and infection, I think are very real questions that we don't have the answers for. But yep. I, like you, am very concerned about it.
Yeah. And so what we're going to see within the next 3 to 10 years, just depending on how many people suffer and how quickly, is that Repatha and Praluent are going to be pulled off the market because the risk of life-ending infections goes up when you take them. Autoimmune condition, severe symptoms flare up. And also the risk of death from cancer goes way up if you're on Repatha or Praluent. So anybody taking those, you might want to just think twice about that. I'd almost rather somebody be on a statin versus Repatha or Praluent, and that's saying a lot coming from me. Do you agree with that statement?
Well, at least I think with statins, the effects are less severe. And, some of the side effects that occur with statins can actually be dealt with proper supplementation. I think the real problem with these medications, again, is, the message that has been prevalent for the past, 30 years now, essentially. It was the late 1980s and the early 1990s that statins became the most widely prescribed class of medication. And the messaging is that this problem can only be addressed with medication. And you need to do it with medication. And it ignores the fact that we can have very powerful impacts on our risk of heart disease if we change the foods that we eat and if we address insulin resistance, because insulin resistance is the real root cause of heart disease. It is the real big risk factor for heart disease.